When the tribes are strong, Oklahoma is strong.
And the tribes invest. They invest in roads. They invest in our schools. They invest in healthcare. They invest lots of money in our communities. If that money were taken away from our communities and sent to the state instead, that money would never come back to our communities.
I mean, I think if you're talking about like healthcare, education systems, obviously the tribes are taking pressure off of the other systems to provide those kinds of services. So, we should applaud the fact that the tribes provide healthcare.
The interactions that we've had with the tribes of Oklahoma have been uniformly positive and valuable to us, but also in some of the urban centers as well, to make healthcare accessible and affordable for those individuals. If those facilities weren't there, where would those patients go? So I think it's been a lifeline to those areas of our state, and it's something that we need to recognize and be grateful for.
The Cherokees are building a medical school in Tahlequah for our medical students, and that's the first ever medical school on tribal lands. So we're very excited about that. That's under construction right now. Throughout our state, we have a critical shortage of primary care physicians. So we're trying to set up residencies around the state in rural areas. Muskogee Creek are very active in their area. The Osage are very active in the Pawhuska area. There's a lot of that activity going on. And I think they're really going to make a mark in rural health.
They're passionate about taking care of their tribal members, but they're very passionate about taking care of all of Oklahomans. And we see that wanting to help us advance our medicine, wanting to provide better access to care to all Oklahomans, to bring the latest technology, the latest medical advancements, the most innovative programs to serve the people of our communities. When they gave to our Arcadia Trails, our Addiction Treatment Center, those gifts make an impact on lives. They're literally changing the lives of Oklahomans that come through that center, and they're saving their lives, not only their lives, but the quality of life for their family members.
I serve on the board of the Caring Foundation, which was founded a number of years ago by Blue Cross and Blue Shield, and operates a number of vans that travel in all 77 counties around the state, providing immunizations and health screenings for children primarily. Tribes have stepped up and fund at least 2 of our vans that operate in rural counties in Oklahoma that wouldn't be being serviced if it weren't for the support of the tribes.
I think that sometimes their contribution is overlooked in terms of how effective it is, and their giving sometimes is quiet, but it's powerful and it's meaningful, and it means a lot to a lot of people across this state. They have always been great partners, great friends, very honorable, always true to their word.
I wouldn't be able to overstate the amount of the contribution they're making. It's really extraordinary. They've been generous and flexible and supportive in everything we've tried to do with them.
We love working with the tribes because when people are healthy, they're able to be a part of the economy. They'll be able to take care of their families more effectively, take care of their children, and that's of benefit to all Oklahomans.
We are united for Oklahoma, committed to mutual respect and productive partnerships. To join the conversation, visit unitedforoklahoma.com.